Warning, you might be causing your own hair to fall out. I see way too many people regret making this mistake with their hair, and I don't want you to make that same mistake either. Let's talk about this. Welcome to About Derm Time. I'm Dr. Pham. I'm a board-certified dermatologist in PharmD. I treat skin, hair, and nail conditions. Many people come to me for hair loss, and a lot of times it's nothing they did wrong. It's sometimes nature, sometimes genetics, sometimes your immune system's going a little funny. But there's one condition that I can unequivocally say that you may be causing your own hair to fall out without even knowing it. When you have progressively thinning hair along the fringes or along areas that have been braided, you may be experiencing something called traction alopecia. This is a condition that is a result of chronic hair tension and trauma to the hair shaft. Hairstyles like tight ponytails, some updos, tight braids, excessive weight, or aggressive brushing can introduce a lot of tension to the hair and hair follicles. As you can imagine, the more tension or stress force that you put on the hair, the more inflamed the follicles can get and eventually fall out. Sometimes you can have no symptoms, but at other times you can experience scalp itchiness, scalp tenderness, or even worse, a headache. That's a sign that it's way too tight. Every hair type has an intrinsic risk of traction alopecia. But here's the thing, this condition is very reversible if and only if we stop these behaviors early and we do the right things to take care of your hair. Why? Because the hair follicles are still there. They're just inflamed and angry. But you have a chance to make it happy again. Comment down below if you and your hair are in a healthy relationship or you need couples therapy right now. As I always say, an ounce of prevention is worth a pound of hair. So please help save your hair. Get yourself a good hairstylist that you trust. Now your best bet is to avoid tension altogether, but if you must use hairstyles that pull on the scalp, it's best to make it not so tight and keep it only for a short period of time. Allow your hair long periods of relaxation. I'm talking about going natural for months before doing it again. If you're already experiencing some visible signs of hair loss due to traction alopecia, that's the thinning along areas that have been braided or hair that's been really tight, please go see your dermatologist right away, because the earlier we can intervene, the better the outcome, the higher the chances that we could get your hair back. But if you let it go for a long time, it may scar over and the hair loss may be permanent and there's no way to get it back. Hey guys, as I was editing this video, I realized I left out an entire section on what I do as a dermatologist to help patients who've started experiencing traction alopecia. Now, if you're starting to notice early signs of traction alopecia, it's best to come in early, because what we want to do is start using medicines like topical steroids or other anti-inflammatories to create a good environment for the hair follicles to recover. Sometimes when it's more progressive, we'll have to start adding medications like topical minoxidil, which I made a whole video on using it orally, and I'll leave a link right up there or down below in the description section. So check that out if you haven't done so yet. Sometimes, like I said, the inflammation is really intense, so we'll add oral antibiotics to help reduce, again, the inflammation around the hair follicles. We use antibiotics not because there's an infection, but some of them just have really good intrinsic anti-inflammatory properties and have been shown to be helpful in inflammatory types of hair loss, specifically traction alopecia and another type called central centrifugal cicatricial alopecia, or CCCA for short. I'll talk about that in a future video. And then other things, so if it's already scarring, a lot of times there's either nothing to do or hair transplant is also another option. Other types of treatment are purely experimental at this point, but as more information comes out, I'll be happy to talk about it. All right, now back to the video. And that's traction alopecia for you. Hey guys, if you guys learned something from this video, please click that like button down below. Let me know in the comments what you want to see in future videos, and please don't forget to subscribe so you don't miss out on any videos that come out. I'll be putting out a new video every week, so stay tuned. Thank you so much for watching, you guys, and have a great hair day. I'll see you guys in the next one. Peace.